Hi and Assalamualaikum. My name is Nurmai Shahara. Before we get started, let me introduce you to my teammates, which are Nurin Kristina, Asha Shafatunisa, Suchiriti, and Nur Darlina Hanim. Today, we are going to discuss about a Gaucher disease that arises from an inherited deficiency of the activity of acid beta-glucosidase. Without much ado, let's get started.
Assalamualaikum and hi. Today our group will be presenting about Gaucher disease. Gaucher disease is a rare genetic illness that causes a fatty material build-up in the body. It has the potential to harm the spleen, liver and bone marrow. There are 3 varieties, each with its own set of symptoms and severity. Type 1 is the most frequent and typically shows itself in maturity, but types 2 and 3 are more rarer and more severe, damaging the brain. Enzyme replacement therapy and substrate reduction therapy are used in treatment. Genetic counseling is essential for impacted people and family of the Gaucher disease.
A very good morning everyone. I'm Nordana Hanimita Aso, and right now I'm going to explain to you guys about cyclolipid metabolism pathway in Gaucher disease. From this, we can see that lactoceramide or ceramide glucogalactose will lose galactose by beta-galactosidase enzyme, and then it will turn into glucoceramide, where ceramide glucose. After that, it will lose glucose and turn into ceramide. However, this process can be back-to-back, and it can happen either it losing glucose and become ceramide, or gain glucose back and become glucosylceramide. This is where glucocerebrosidase enzyme doing its job. And then after that, when galactoceramide lose galactose, it will turn into ceramide. Here, let's continue with pathology of Gaucher disease. So, Gaucher disease is the result of a buildup of certain fatty substance in certain organs, particularly your spleen and liver. This causes this organ to enlarge and can affect their function. The fatty substance also can build up in bone tissue, weakening the bone and increasing the risk of fractures. First, senescent cell membranes, which is irreversible cell cycle arrest in response to various types of stress will happen. And then after that, catabolism of glycolipid happen, and then it will happen where glucocerebrosidase, where it is a lysosomal enzyme that is deficient or defective in the inherited condition known as Gaucher disease. The enzyme will act in lysosomes upon the cyclolipid glucocerebrosidase, catalyzing its conversion to glucose and ceramide. And then you also can see from the right side, mutation in gene will happen, and then deaf glucocerebrosidase, which an enzyme of mammalian tissue that catalyzes the hydrolysis of the glucose part of glucocerebrosidase and is deficient in patients affected with Gaucher disease. After that, accumulation of glucocerebrosidase in phagocytic cells, and lastly, Gaucher disease will happen.
Disease is the most common of the lysosomal storage diseases. It's a rare inherited disorder resulting from a deficiency of the lysosomal enzyme glucocerebrosidase. Glucocerebrosidase is produced in the endoplasmic reticulum of the cell and transported via the Golgi apparatus to the lysosomes. Once there, it catalyzes the breakdown of its main substrate, glucocerebroside, into glucose and ceramide. Glucocerebroside is the building block for 90% of glycosphingolipids that are found in the plasma cell membrane and are essential for vital cellular activities. Deficiency of glucocerebrosidase leads to the lysosomal accumulation of glucocerebroside, predominantly within macrophages and macrophage-like cells. Macrophages laden with excess glucocerebroside are known as Gaucher cells and have a characteristic appearance. Accumulation of Gaucher cells in the liver, spleen and bone marrow gives rise to the typical clinical manifestations of Gaucher disease. Gaucher cells also secrete cytokines, which can contribute to the signs and symptoms of disease.
3 stages for Gaucher disease, which are type 1, type 2 and type 3. For type 1, the patient didn't have enough platelets in their blood. This can make them bruise easily and feel very tired, or also known as fatigue. The symptoms can start at any age. They might have an enlarged liver or spleen. They may also have kidney, lung or skeletal problems. For type 2, this form of the disease affects babies by age 3 to 6 months. It is fatal. In most cases, children don't live beyond 2 years old. For the last type, which is type 3, the symptoms include skeletal problems, eye movement disorder, seizures that become more obvious over time, blood disorder, breathing problems, and also liver and spleen enlargement. There are symptoms that we can see when someone have this disease. So the first one is there are yellow spots in their eyes. Next, they have enlarged liver, and then they will have extreme tiredness, which is fatigue. Furthermore, they will have seizure, and then they also can have lung problems. And the last one is they will have enlarged spleen. For the causes, Gaucher disease is passed down from parents to children. It is inherited. It is caused by a problem with the GBA gene. It is an autosomal recessive disorder. Each parent must pass along an abnormal GBA gene for their child to get Gaucher disease. Parents may have only one GBA gene and therefore not show any signs of the disease, but be carriers of the disease.
How Gaucher disease is diagnosed. Gaucher disease can be tested with a standard blood test called a beta-glucosidase leukocyte test to check enzyme activity and diagnose Gaucher disease. However, most physicians are unfamiliar with Gaucher disease. A pediatrician may notice an enlarged spleen platelet problem and low platelet without considering Gaucher disease. Next, there are 3 types of lifespan in Gaucher disease. The first one is that adults with the first type of Gaucher disease can expect normal life expectancy with enzyme replacement therapy. The second type is the children with the second type of Gaucher disease will die before they are turned into 5-year-old. And the third type of Gaucher disease is the individual with Gaucher disease may survive into adolescence or adulthood, but the severity of symptoms can vary widely.
As for the treatment, unfortunately, there is no cure for Gaucher disease. Therefore, a variety of treatments can help in control symptoms in order to prevent any irreversible damage and improve quality of life. However, some people have such mild symptoms that they don't need treatment. Gaucher disease can be treated with medication and surgery. The treatment for Gaucher disease may include enzyme replacement therapy, spleen removal, bone marrow transplant, miglustat, or also known as Zavesca, and last but not least, eliglustat, or also known as Sardelga. For medication, enzyme replacement therapy is an approach to replace the deficient enzymes with artificial ones. The treatment is done via infusion of imiglucerase, a synthetic called glucocerebrosidase. Enzyme replacement therapy, or ERT, is a good alternative to manage symptoms of type 1 Gaucher disease, as well as relieve pain and prevent any additional bone loss. Next, miglustat, aka Zavesca, is an oral medication appears to interfere with the production of fatty substances that build up in people with Gaucher disease. Zavesca is used to treat mild to moderate type 1 Gaucher disease by people who cannot receive enzyme replacement therapy. Diarrhea and weight loss are the common side effects. Therefore, Sardelga is used to treat mild to moderate type 1 Gaucher disease in adults. It reduces the formation of a certain protein in the body in people with type 1 Gaucher disease. It is used only if a specific liver enzyme T-do6 in body breakdowns or metabolizes drugs at a certain rate. Any possible side effects include fatigue, headache, nausea, and diarrhea. For surgical procedure, spleen removal or splenectomy was the preferred treatment for Gaucher disease until the advent of enzyme replacement therapy (ERT) in 1991. Splenectomy now is only performed in cases of severe splenomegaly, which is called enlarged spleen, that do not subside despite continued ERT. On the other hand, with bone marrow transplant, Blood-forming cells that have been damaged by Gaucher disease are removed and replaced, which can reverse many of Gaucher signs and symptoms. Since this is a high-risk approach, it is performed less often than enzyme replacement therapy.
So, in a nutshell, even though there are no known cure for Gaucher disease, treatments are available to manage symptoms and improve quality of life of the disease. Enzyme replacement therapy and substrate reduction therapy are two of these treatments for Gaucher disease. There is ongoing research to uncover potential remedies, but additional studies are required. Individuals with Gaucher disease have to team up with their healthcare team and receive regular monitoring and assistance. That is all from us. Thank you so much.